welcome to the Health Equity Lecture Series, presented by the FDA Office of Minority Health and Health Equity. As part of our observance and celebration of Hispanic Heritage Month, we bring you a conversation with Dr. Delgado and Dr. Sandoval on communicating and engaging with the Latino communities. I'm your host, Dr. Christine Lee, the Acting Associate Commissioner for Minority Health and Director of the Office of Minority Health and Health Equity at FDA, where we have a dedicated mission to promote and protect the health of diverse populations through research and communication of science that addresses health disparities and advances health equity. And I'm glad to welcome Dr. Delgado and Dr. Sandoval to the webinar for this important discussion. Dr. Delgado, who's joining us on Zoom today, is an Associate Professor of Healthcare Administration in the College of Business at Texas Women's University. Dr. Delgado is a health economist specializing in cost-effectiveness analysis, population health analytics, and health disparities research, specifically in healthcare access for at-risk populations. He is an expert in the development and implementation of graduate educational programs in health economics, healthcare management, healthcare policy, and public health. Dr. Delgado received a BA from the University of Chihuahua, Mexico, an MBA from the University of California at Berkeley Walter A. Haas School of Business, and a PhD from the Texas Health Sciences Center at Houston. Dr. Sandoval, who's here in the studio with me, is the president and CEO of Emerson Clinical Research Institute. Dr. Sandoval is also the four-time Emmy-winning host of Tu Salud Tu Familia, as well as a medical contributor to NBC Telemundo and Univision. Dr. Sandoval has more than 25 years of bench-to-bedside research experience. His diversified research career has been in academia, healthcare systems, and the public sector. He's received his Bachelor of Science in Molecular and Cellular Biology from Marymount University and his Doctor of Medicine from the Autonomous University of Guadalajara School of Medicine. Welcome, Dr. Delgado and Dr. Sandoval, and thank you for joining us. Before we get started, I think our viewers would be interested in learning how both of you got your start in research. Can you tell us a bit about your personal journey and your career trajectory? Dr. Delgado, we'll start with you, and then Dr. Sandoval can share.
Good morning, Dr. Lee. Thank you for the opportunity. I think my interest in research started when I was very young, as a child, watching my dad and so forth. And speaking of my family, I think those values that I inherited from my dad, my grandmother, my parents, and so forth, is what really have been driving me and the rest of my children and family now. And it basically boils down to this: pursuing your fulfillment, your interest on one side; second, dedication to a strong work ethic; and third, lifelong learning attitude. To give you an example, my grandmother, she finished her master's in education at the age of 80, thinking of pursuing a PhD at age 88, 2 years later, but then she came down with cancer and so forth. But the third component that I think is important to consider is the fact that we always been inspired or asked to serve our community. So I think that's the driving force that keeps me interested in research, and combined with that, teaching, making sure that we're providing to the next generations of researchers the tools, the knowledge, the understanding of what they need in order to make our communities better. So that will be my response.
Christine, very interesting that you asked that question, because just like Dr. Delgado, I also got started very young. My research career was started when I was 16 at the NIH. I was fortunate enough to be part of this, it's called the IRTA Fellowship Program. So it's intramural research training program for kids, and got me started to learn to wash dishes in the lab, learn what an Erlenmeyer flask was, learn to pour acrylamide gels for DNA sequencing. Doing all this stuff got my bug into research. And thanks to the fact that I was at NIH, I started to see other scientists bringing blood from a sample. It's like, human blood? I was like, where are you bringing this human blood from? Oh, there's a hospital right down the street. What are you talking about? Are you telling me I can do research and see patients at the same time? this is fantastic. And that got my bug going into, wow, research and science can be one. I can see patients and I can conduct clinical trials. I didn't know what clinical trials were at the time, but that's kind of what got my brain going into clinical trials. And the fact that I was able to do so freely. I had the resources, I had my parents' support, I had my school support, I had mentors. Even though no one in my family knew what this path I was taking was, I had people in the community helping guide me through this crazy understanding of what science was, what the university system was like. And that pushed me later on in my career to help my own community out, help to see how can we support more. My parents didn't understand a lot of these medical terminologies, right? Which is why I went to Mexico to hone my bilingual medical skills. And by doing so, I came back to the US being a true bilingual physician, a true bilingual scientist, where I was comfortable explaining to our community why they should trust the work that we're doing. And that, in a nutshell, is kind of what got me into clinical trial.
As you know, at FDA and throughout the nation, we're celebrating Hispanic Heritage Month, and I know you both have extensive experience working with Hispanic or Latino communities regarding health literacy, outreach, and education, as well as healthcare access and management. Can you please share an overview of your work with us? Dr. Sandoval, we'll start with you this time, and the next question will be for Dr. Delgado.
We've developed this new platform that we're titling CHAMP, which is Community Health Advanced Medicine Portal. This portal is going to be used across the country, and it's going to be spread out through the consulate works that we support, to the TV show that we do, to the community boots on the ground work that we do, so that people can become part of this global platform where they're going to receive education, access to low-cost clinics, watch our TV show, ask us questions, have access to clinical research. This is hopefully going to be a new way where people can become part of a new community and learn. Once they learn and once they trust what's going on in a safe space, just like we're doing with the TV show, just like we do in the community clinics, just like we do with the consulates that we serve, this is the next level tier that hopefully people will see that there is value to help managing their care.
Dr. Delgado, your project funded by the FDA Office of Minority Health and Health Equity focuses on mitigating the spread of misinformation and disinformation among Hispanic or Latino communities. Can you please explain the difference between disinformation and misinformation and share any takeaways from your findings?
Yes, absolutely. And the definitions are quite simple. Misinformation are the wrong facts, essentially. Wrong facts that are distributed or promoted throughout the community. Disinformation, however, are wrong facts, but distributed with the intent of misleading the audience. As simple as that. Now, from our work, why we're interested in that is because, as we know very well from the experience of COVID and the use of social media, that misinformation and disinformation can be sources of problems for the communities like the Latino or Hispanic communities, receiving wrong facts, wrong data, and so forth, and consequently misguiding their health-seeking attitude or behaviors. So to us, that's been critical, and I think with the experience of COVID, it was very important for us to understand the dynamics and the way that misinformation and disinformation spreads throughout the community. We know well that with social media, things happen at light speed versions. Right? So it is important for us as representatives of public health providers and so forth, to make sure that we understand the dynamics of that diffusion of misinformation and disinformation, so we can react appropriately and make sure that our messages are tailored to the needs of our community and be able to minimize the effect of those conditions, misinformation and disinformation.
Any findings you want to share also, Dr. Delgado?
Yes, absolutely. We found several differences, if you will, in terms of the type of use of social media that end users might have. And that varies by age groups, right? So, and we found a number of similarities. To give you some examples, we know that the younger populations, for example, tend to use more a specific platform. TikTok nowadays, Facebook less, that's more now I think of the past most likely. So if you're using Facebook, I can wager that you're over 35, 40 years old, something like that. Whereas you're using TikTok and referring to those platforms, you're likely to be younger than 40. And so things of the nature of the usage of the different platforms is critical as well in terms of defining a specific message. The other thing we found is that there's differences in the type of sentiment, if you will, that people might have or post in different messages according to age groups or location, right? So, for example, if you ask a person, an older person, 45 and over, what was the type of sentiment that they were feeling during the height of the pandemic, that will be very different from what the younger populations might have felt. To be more specific, the older populations had a sense of isolation, if you will, whereas the younger populations were more resentful of the fact that there was not much interaction, physical interactions with friends and so forth, right? So that type of message, or that type of sentiment, I should say, is critical in the way we can define or manage our content for those messages and be able to convince the population that a wrong fact that's been distributed is indeed wrong, and consequently provide an alternate solution that is more appropriate to whatever the situation might be. So in conclusion, the big findings go around the type of channels and platforms that people use, as well as the type of message that we can actually design in order to make sure that the recommendations that organizations like Dr. Sandoval's provide are actually well positioned to be received by different segments of the population. And also another important thing is the fact that the way the terminology and the timing of the message is important, and it varies depending on the type of ethnic group. And within each ethnic group, should we say, the country of origin. To give you an example, it's not the same thing to talk to a person from Colombia, for example, whose roots are in Colombia, than it is to talk to a person whose roots or ancestors come from Mexico. Yes, we both speak Spanish, but there might be some terminology and the way we address people and so forth might be different. So we have to be very aware of those distinctions. Okay? And lastly, and I think this is very important, is the fact that we are now understanding the dynamics and the speed of diffusion of information through these social networks. And that's important because it tells us that we as public health experts or healthcare providers have to be on top of that game. We have to make sure that we understand that the speed of that dynamism in order to be able to support our community and make sure that our community remains at an educated level and they can pursue the best options to stay healthy.
Turning back to Dr. Sandoval, are there particular barriers and health disparities that you've noticed while working at Emerson Clinical Research Institute? Do you see any overlap on the role of misinformation and disinformation, similar to what Dr. Delgado shared?
You know, Dr. Lee, absolutely. As I'm listening to Dr. Delgado speak, it reminds us, on our TV show, we have a segment called Mitos y Realidades, right? Fact or fiction, because we hear so much disinformation. At the clinic, when they come into clinical trial activity, the same stuff. We hear it, and we're debunking it on the TV show, and we're debunking it face-to-face with patients. There's a lot of stuff that, it's just what I would say, I know what I'm good at, and you know what you're good at. So it's okay that you don't understand all the medical things that are happening. I don't know what a mechanic does, how to fix a car. That's not my thing. He has to educate me, so I have to educate our community. Because the misinformation that we're getting is types of treatments that they use, a bunch of, let's say, hokey pills that they sell that really don't have any FDA regulations on. And this misinformation can hurt people. And it happens time and time again. So that is the biggest similarities I see. Now, the barriers that come across us are very simple, that we can help them with. It's timing. Patients sometimes work multiple jobs. So we need to make sure we open at 6 a.m., bring them to the office if we have to, provide transportation, work with sponsors to say, we need to provide this so that our patients can get to the office on time, get their treatment, and go to work. Stay late, open on weekends. Not a lot of institutions want to open on weekends, but if we really want to help our community, we have to open on weekends, right? Finance. Sometimes they can't afford it. So we have to help them come up with solutions that are affordable. In clinical trials, fortunately, there is no cost. And I talk to them about the risk benefit of participating in a clinical trial. Health access, regardless of the fact that you're documented or undocumented, sometimes individuals can't get health insurance. It's expensive, especially if you are self-employed. A lot of our community do their own little businesses and they can't afford that. So we need to break down those barriers, and we're doing it by having low-cost community clinics, by staying late, by providing services, by working with other partners. Dr. Lee, if a patient needs a mammogram, we have worked with other organizations where we can provide those. Through the consulates that we work with, the patients may come to us and they may be further away, but our network is expanding so that we can pick up the phone and say, there's a patient that lives in your area that might need your free services through our new CHAMP platform. So we're trying to break those barriers, and they exist. And the number one thing that we need to continue to break down, Christine, is trust. They trust us because they see us in situations where we can empathize with them, where we speak their language, where we know what they eat, where they know where they work, how they live, and move past that and become successful and helping them get rid of these barriers. It is totally possible.
Thank you, Dr. Sandoval, for diving into the various barriers that you've encountered in your work. Can you please explain a bit more about the importance of health literacy, both personal and organizational, and how education and outreach can help people in any community?
You know, health literacy is the driving force to what we do, which is why yesterday I saw a patient that used a vegetable to try and take care of himself. And you know what ended up happening? He ended up burning his skin because he did not understand simple things that we can help him with. So the health literacy component starts from the moment they watch us, they hear us, and they talk with us. I always say, don't talk down to a patient, right? Talk to a patient. We need to understand what that level of conversation is like so that we can connect. Because once we've connected, the health literacy starts to grow. And they start to trust. I go back to that same word because that health literacy gets stronger, and then they themselves can take that word and spread it to their family members and become more knowledgeable and become more health literate. You don't have to have a college degree, a medical degree, to understand simple medical activities. And that's what I try to joke with my patients and say, it is possible. Just let's turn it around a little bit. Don't use lemon on your eyes. Don't use lemon on your skin. Use lemon on your shrimp and use lemon on your fish. That's what you want to use it for. Let me give you the proper medications that really will work.
Dr. Delgado, turning back to you now. Is there anything that surprised you about your research study in El Paso?
Yeah, and echoing what Dr. Sandoval was saying is the level of misinformation that might be founded in our communities. To be honest, misinformation and disinformation are not new, by the way. They didn't happen with the social media, with the pandemic alone. I have another example. The use of chamomile tea to improve your eyesight, whatever, that's a wrong fact. So that was one of the surprising things. The other thing that was of great interest, we were measuring the level of trust. Dr. Sandoval was talking about that. And we were happy to find that in communities, small communities, like El Paso and other ones that are remote in some rural areas of Texas, there's a great deal of trust in the medical profession, the doctor. Obviously, along with the family members, right? The grandmother, the mother, the brothers who went through, survived COVID and so forth. That's also one source of trust, if you will. But also the CDC was mentioned many times, and we were also measuring the level of trust coming from universities and public health departments. And yes, it varies by different communities, but overall, the degree of trust was considerable when it came to relying, or the population relying on messages coming from those institutions. But more than anything else, what surprised me is the level of trust that people have in the community level organizations, just like Tu Salud, Tu Familia program that Dr. Sandoval manages. There's similar programs throughout Texas and El Paso specifically. And believe me, the way, if you want to get to the heart of someone who's unsure about what to take best for a specific condition, those channels are the best in our view. Any strategy that involves health-seeking behavior, improvement, and so forth, has to rely to a certain degree on those networks of communities, and not only community organizations. And I'm not only talking about federally qualified health centers, which are very successful, but also those non-for-profit organizations like Ayuda Inc. in El Paso that have the pulse of the community, have the trust of the community. That's essential. The other thing is there's also a great deal of trust with providers that might not be physically located where you are. We had a number of participants in our focus groups who were coming from Colombia, of all places, and to get proper advice, they would tell us, they would call their doctor back who had been treating the family, grandmother and so on, for a number of years, and rely on their opinion to verify whatever the local doctor in El Paso was saying. So that dynamic is also important. We have to understand not only who are the immediate sources of trust, if you will, the institutional, but also the family context of that. So that's part of the items that we were surprised with that I believe will help us define better strategies and provide recommendations to the public health department and organizations like Dr. Sandoval.
Thinking in more general terms beyond your research, I'd like to hear from both of you on what approaches you think are working that help to reduce health disparities among Hispanic or Latino populations. Dr. Sandoval, you can go first.
Sure. Probably one of the biggest things that works for us and should work for other organizations is to actually partner up. Partner up with the community, work with community leaders, churches, elected officials that believe in what we're doing. And sometimes it's hard to get to those individuals. So I would start, and what we normally have done is started with institutions that support the community already. Bring them together because we can't do it all, right? We need to know where to refer patients, where patients need to get referred to us, and talk to those institutions to say two things. Number one, we're going to share the support that we're giving them. We're not taking someone from you. We're working together to make this person's life better. Once we do that, it is tremendous. And then that network will really help expand the support for the community. And to this day, health fairs, especially in our communities, are tremendous. We just did a health fair a few days ago. From 10 a.m. to 4 p.m., we ended up seeing 68 people, right, that we provided services to them. But it's having these services that are at no cost, that educates the people, and then bring them back to do more services for them in a health setting like a health fair is fantastic, and it works, and it's a win-win-win for everyone.
Now we'll go to Dr. Delgado.
Thank you, Dr. Lay. That's a very good question, and I agree with all the comments that Dr. Sandoval mentioned. As you well know, the social determinants of health are critical in terms of promoting health among the community. And along that, I have to add the fact that I believe that there's several very important programs in the community that are providing ways of improving health. And that includes the federally qualified health centers that offer, in some case, not only medical services, obviously primary care that is, but there are links to the hospitals that have second and third level type of care. But there's also FQACs that offer housing for patients and so forth. So those type of services are critical. The other one is the programs of community health workers. They seem to be working extremely well in communities, not only rural, but also urban, especially if we're talking about promotoras or the health promoters who tend to be bilingual, not only in Spanish, but also in Vietnamese and in other languages, depending on the community. So those are programs that I really think are successful in our community and are helping minimize disparities. And we should continue to support those. And from my work, those have been incredible resources to reach out to the community, recruit participants in our studies, and understand clearly the needs of our Hispanic community. And lastly, I think it's important to give credit to programs like Dr. Sandoval's with the CHAMP platform that are using the latest technology, if you will, to reach the Hispanic community. That's critical. So I believe in general that we're moving the right path. We just need to make sure that we support those different services with our research as well.
For our final question, what advice would each of you share with our younger researchers who are just starting their careers in health equity research? We'll start with you, Dr. Sandoval.
Advice is great. It's following through with the advice, and everyone has a different way of approaching it. I always say, have a mentor, right? Have a great mentor that's going to guide you through this health equities issue. Be engaged. Don't just sit behind the desk. Don't just stay behind the computer. Go to where you think those problems exist and see it firsthand. Experience it, smell it, see it, touch it. Because if you truly understand the problem, it's going to make you a much better scientist when you're actually helping to develop these solutions. And don't just go once, go back and see if your work has improved. Go back and keep learning. We can't just think that because we did it once, we know it all. We have to ourselves be this perpetual student and always learn so that we can become better scientists and really help our community. That is probably the biggest piece of advice I can give anyone.
Dr. Delgado, I'm turning it to you.
Thank you, Dr. Lee. I always start my classes every semester by giving a background on my research interests and having an open invitation to all my students to join me in that research. And that's given me an opportunity to interact with a number of students at different levels, undergrad and graduate. And my advice to them has always been follow your dreams, develop your work ethic, and make sure that you have very clearly what you want to do with your skills and how you're going to serve your community. And by the way, Luis, if you're watching this, I mean you and Marlon and all my students that have been involved in that and have received that invitation. We need people who have interest in our community, who have the skills and have the interest to help our community. And that is students like you guys. So that will be my answer, Dr. Lee.
And with that, I want to thank both you, Dr. Delgado and Dr. Sandoval, for joining us today for a great conversation. Before we close, I want to encourage our viewers to visit the OMHHE website, www.fda.gov/health-equity, to learn more about our initiatives and resources. Thank you for tuning into the discussion and happy Hispanic Heritage Month.